Florida continues to lead the country in new COVID infections, averaging roughly 20,000 new cases every day. Data from the Federal Department of Health and Human Services reveals Florida's hospitalizations have broken daily records for 11 days in a row now. First responders in one Florida county pleading with the people there to think twice before they call 911 because they're struggling to contain the surge. Again, just like the bad old days of the pandemic. The Miami Herald reports, quote, this new wave is increasingly affecting younger populations. In terms of the number of children hospitalized with COVID-19, Florida has ranked among the 2 worst states in the nation, and hospitals have been sounding alarms. Despite the urgency to protect children with things like school mask mandates, the governor remains opposed.
We believe this is a decision for the parent to make. What we found, fortunately, is there's actually was higher infection rates when you're just in the community versus when you're in the classroom, particularly for the younger kids. You know, these kindergartners and first graders, you know, they're not people that are really transmitting this in significant levels.
Here to help us make sense of all of it, Dr. Aileen Marty. She's a professor of infectious diseases at Florida International University in Miami. She's a veteran of global medicine with the World Health Organization and is now part of a task force advising public schools in Miami on the pandemic. And doctor, let's start with a situation report from you about how bad things are in your area, please.
Things are very bad. Hospitals are between 100 and 160% capacity. And I'm talking about the major medical centers that we have, like Jackson and Baptist and so forth. Our urgent cares are backed up. People are waiting ridiculously long hours to get attention because each COVID person requires a lot of care, requires a lot of resources, and that takes away resources from every other type of medical care that we need to give to members of our community. And it's really very dramatically stressing our system, especially our healthcare workers, our nurses, our physicians, our technicians. Everyone is under a tremendous amount of stress, and we're running down on some resources as well.
Doctor, I try to avoid dragging you into politics, but in this case tonight, I find it all but inevitable. And I want to ask you what it's like to be in your line of work in a state where the governor is anti-mask, especially and including where it applies to children.
Brian, that is the million-dollar question, because from my perspective, I am only looking at what is the risk-benefit ratio of each public health measure that we do or don't use, right? And if you look at the risks, which are trivial from the use of a mask, compared to the benefits and what you're preventing, there's no question that it's going to reduce transmission. We know masks work very, very well in clinical settings. We have many studies, and we've known that for decades. That's what you don't want your dentist not wearing a mask when he's in your mouth. These things are fundamentally, and we know they're true. And now there's plenty of studies that show the value of masks in social settings. What we don't know is exactly what the best policy is for the use of masks. But because we know that masks help and will reduce transmission, and they only really work when everyone around you is doing it, because once there are people without masks who are shedding virus, the amount of virus in the atmosphere in an unventilated room becomes so high that it can overwhelm the protection you have from your mask, and it may also overwhelm the protection you have from a vaccine. So you want to layer as many protections as you can, and you need other people to be wearing their masks as well. And this is a fundamental thing that we have to recognize, is that, yes, we want liberties and freedoms, but my freedom ends when I'm endangering your health. There's a limit in society. We can't be irresponsible. We must be responsible, not just for ourselves, but for those around us. We mustn't put other people in danger. And we have many laws about this. For example, We have laws about secondhand smoke. You can't smoke in a restaurant these days because you're putting other people's lives at risk. So there are freedoms that we voluntarily give up in order to protect others. And I think it's important that we recognize that there's also freedoms that we give up as parents. You're not allowed to leave a minor at home alone for very, very good, sound reasons. So when we impose public health mandates for one reason or another, it's to the benefit of society at that time, in that moment, and in order to do the best thing. And that's what these issues are about when it comes to our current situation in Florida, which is very, very dire and are incredibly high viral loads. We're up to 617 cases per 100,000 in Miami right now, in Florida right now. And that is just not a place where we can sustain not using additional protections. Even the vaccines can be overwhelmed. Everything can be overwhelmed if the dose is really high.
Final question. This report about ventilators from the national stockpile heading your way, however much the governor says he was not aware of this, didn't request it. It sounds like, God forbid, you may need them.
I'm so sorry to say that is happening. We are having to put more people in ICUs. The percent of our population in ICUs now has gone up, and our need for ventilators has gone up. So we're grateful that more are coming our way. We're also going to need more staff. Our staff is really overworked.